Welcome, everybody. Thank you for serving as a 2021 RWJF Culture of Health Prize reviewer for the first phase of the prize annual selection process. I am Angela Acker from University of Wisconsin Population Health Institute, and I will serve as your key contact as we move through the review process together. Also presenting with me today is Erin Schulten, also with UWPHI. Carrie Carroll and Dr. Olivia Little will be monitoring our chat today. The coronavirus pandemic, ongoing injustices and inequities across the nation underscore the importance of community conditions and collective efforts for all residents to have a fair and just opportunity for health. That's why it is critical now more than ever to uplift stories of communities building a culture of health. So thank you. Thank you for deciding to participate as a reviewer for this selection process as we review potential communities that exemplify the prize. Before we get started, let's do a quick roll call for the rest of the group via Zoom chat. So chat your name, organization, one lens or perspective you are bringing to the review. And as those chats continue to roll in, I'm so glad you could join us today. Here is what we will be covering today in this 1-hour orientation. For those of you who are new, we'll provide some brief context of the RWJF Culture of Health Prize. We'll summarize key dates and deadlines, and for those of you who are returning as reviewers, we'll share what's new this year. We will also share what was asked of community applicants and provide an overview of review purpose, components, prize criteria ratings, and recommendations. We also are we'll also have some reviewer tips and guidelines to share, which is relevant for newer and more experienced reviewers alike. Lastly, we'll touch on what is expected for the Phase 1 review meeting on November 11th. So let's get started. I'll pass it over to Erin to go over the purpose of the prize.
Great, thanks, Angela. So as you know, the prize is designed to honor and elevate U.S. communities working at the forefront of advancing health, opportunity, and equity for all. So in the chat, let us know what comes to your mind when you think of communities at the forefront. The prize was designed to shine a light on communities that represent the Robert Wood Johnson Foundation's vision of a culture of health in action. Prize winners each receive a $25,000 prize, which the community can use in any way they choose. But the value of the prize goes far beyond the dollar amount. It is a national recognition that honors and elevates the work being accomplished in communities across the nation. Communities will also receive customized communications materials, communications funds, which give them the opportunity to determine the communication tools that will best support their work. Communities will receive communication support to aid in the national and local promotion of their stories. And winners will have opportunities to connect with other national and local leaders working to build a culture of health, such as with past prize-winning communities. So to date, 44 communities have been designated as RWJF Culture of Health Prize winners. The map here shows all of the winners from 2013 through 2019. The winning communities span 26 states, including 5 federally recognized tribes. You can see that the prize recognizes all types of places: cities, counties, tribes, small rural towns, and interconnected regions, representing a wide range of physical, economic, and demographic characteristics. These places and their community improvement efforts are each unique, but they all show us what a culture of health can look like. As a reminder, we also have 8 2020 cycle finalists, which are also a real mix of communities, including representation from different states across the country and a federally recognized tribe. But due to the COVID-19 pandemic, we will conduct their Phase 3 review concurrently with the 2021 cycle finalists next year. Then the 2020 and 2021 prize-winning communities will be announced in fall 2021. Now for reviewing, the prize call for applications is a key resource for you as it provides details of the competition and the selection criteria. The CFA is included in your reviewer materials as well as on our website shown here, and we encourage you to have it in front of you as you work on your reviews.
The prize competition consists of 3 phases. The Phase 1 applications will be submitted by all interested U.S. communities on October 15th. These are the applications we will be reviewing from October 21st to November 5th. Based on our reviews, we will invite selected communities to submit a Phase 2 application for the competition. Then, from the Phase 2 applications, up to 12 communities will be selected as prize finalists and will participate in Phase 3 of the selection process in the spring of 2021. Following Phase 3, the prize winners are selected and will be announced as winners in fall 2021. Looking at key dates for the Phase 1 review, we want to emphasize that the turnaround time for this process is very tight, so these are hard deadlines. Your reviews will be available to you in my.rwjf.org on Wednesday, October 21st. You will receive an email from MyRWJF that includes instructions for accessing your reviews. If this is your first time reviewing anything from RWJF, you will first need to register in the system, and the email will have directions on how to do that. Once you receive that email on Wednesday, we ask that you go into the system as soon as possible and review the names of the communities that have been assigned to you, as well as the names and organizations of the first and second contacts listed on the application. We would like to know as soon as possible whether or not you see any potential conflicts of interest with the applications assigned to you, and no later than Friday, October 23rd. We will go over these guidelines in a moment. All reviews are due by Thursday, November 5th at 5 p.m. your local time. Again, this timeline is very, very tight, and we are not able to grant extensions, so please submit your reviews by this deadline or earlier. And on Wednesday, November 11th, we'll hold the Phase 1 review meeting to discuss the outcome of our reviews and make decisions about which applicants will advance to the next phase of the selection process. When you open your reviews in MyRWJF, you will be prompted to acknowledge the conflict of interest guidelines. Main conflict areas identified by RWJF are highlighted here. Full guidelines can be found on my.rwjf.org in the resources section on the left side of your review homepage. In addition to the general guidance from RWJF, the Prize National Advisory Group has adopted additional guidance on this topic, given the community-wide focus of this award. So, you would also declare a conflict if you meet any of the following criteria found on this slide. If you think you may have a potential conflict of interest, please contact me, Angela, right away to discuss the community and our conflict policies. If we determine there is indeed a conflict, we'll discuss next steps. So please do this as soon as you can. Let us know if you do or do not have any conflicts of interest no later than Friday, October 23rd, so we can make any necessary adjustments. We know we have reviewers with varying levels of experience with the prize selection process. So tell us how many years you have been reviewing with us. Erin is going to put up a quick poll right now to see our breakdown. And since we know that many of you have done this before, we want to be clear about what's new this year. We made select changes to the prize criteria language to further reinforce principles of equity. We also added a mention of housing as a social and economic condition in criteria number 1. The biggest change within Phase 1 application is where you will find the community's demographic information, which is immediately after the instructions of the Phase 1 essay. You will find 3 questions for the communities to supply their population size, racial and ethnic background, and children in poverty rate. The biggest change in the Phase 1 review is the new undecided recommendation option that is replacing the maybe option. We will spend time on this later in the orientation. We also acknowledge that the coronavirus pandemic has highlighted existing inequities. However, not every community is impacted the same by this novel virus. Therefore, there is no expectation that communities feature a COVID-19 accomplishment. It is expected that communities identify how they are addressing a fair and just opportunity for health.
Okay, now we want to overview the Phase 1 eligibility guidelines and the application components. As reviewers, we ask you to keep in mind that the prize honors whole U.S. communities. To be eligible, applicant communities must be a geographically defined jurisdiction within the U.S. that falls into one of the categories on this slide and in the CFA. Applications that focus only on a neighborhood or a set of neighborhoods within a municipality are not eligible under our definition, and applications that represent the work of a single organization are also not eligible. We do want you to be aware of these eligibility criteria, but please know that prior to the Phase 1 review, prize staff will have done their best to screen out any applications that are not eligible. In addition to not meeting our definition of an eligible community, applications are screened out if they fall into any of the other categories listed on this slide, such as if the application clearly represents the work of only one organization or initiative, or if the application showcases fewer than 4 accomplishments. So you shouldn't see any of these types of applications in your review pool, but if you do, please contact us with any questions you may have about it. Now we'll move on to the application components. The application includes contacts, demographic information about the community, an essay, and a summary of accomplishments. In the essay template, the community provides demographic information on population size, racial and ethnic breakdown, and the rate of children living in poverty. Please note that the demographic information provides additional context of the applicant communities as you review. For example, the rate of children living in poverty is a measure that helps reviewers understand economic factors in the community related to income and poverty. However, we do not select a certain amount of communities based on the demographics. Then the meat of the Phase 1 application is the 5-page essay. So now I will go over that. The main focus of your review will be the 5-page essay. The first section of the Phase 1 essay asks applicants to introduce their community. Applicants are instructed to tell us a little bit about the community, including who in the community is most affected by poor health outcomes and what root causes are driving community health conditions. Applicants are then asked to describe how the community's health improvement journey began and what catalyzed collective action, such as an event, opportunity, or decision. Then in the second section of the essay, applicants are asked to identify and describe 4 accomplishments that they have achieved in the community, which when taken together, demonstrate how the community is defining health in the broadest possible terms, as described in Criterion 1. Accomplishments are specific policies and programs or strategies that best respond to identified community needs and that show how the community is making progress towards better health, opportunity, and equity. We encourage applicants to weave in information about how their accomplishments address the key challenges that the community faces and describe if there are certain ways their accomplishments may impact or intend to impact historically excluded populations or geographic areas. We really want to get a sense of what crucial needs and health gaps exist in the community and how they are prioritizing actions that improve the overall community and address disparities. Now, as reviewers, please keep in mind what an accomplishment is and is not. Accomplishments can be well-established or relatively new policies, programs, or strategies. We encourage applicants to demonstrate a balanced approach to community improvement that may feature well-established accomplishments as well as newly implemented efforts. Applicants often ask whether an accomplishment needs to be one specific strategy or whether it can be a group of strategies, and it can be either. Some accomplishments may focus on a particular policy or program, while others may describe a suite of activities the community is doing to address a pressing need, such as early childhood education or community safety is one accomplishment. Now, for the purposes of this application, accomplishments may not be planning or convening processes or the development of a coalition or initiative. So for example, conducting a community health assessment and developing a community health improvement plan would not count as accomplishments on their own. We do recognize the importance of creating coalitions and bringing people together to do this and doing this kind of planning, but they should be considered as the predecessors for the accomplishments. They are the foundation on which the accomplishments are built. So we like to hear about these processes in the introduction, but as an accomplishment, we want to know what resulted from the coalition coming together or a community health improvement plan being developed. In the essay, we also ask applicants to be explicit about how their accomplishments taken together address criteria 2 and 3. They are asked to describe how their accomplishments represent sustainable systems changes and policy-oriented long-term solutions as described in criterion 2, and how their accomplishments demonstrate creating conditions that give everyone a fair and just opportunity to reach their best possible health as described in criterion 3. We hope that these added instructions will give you as reviewers more clear and direct information about how communities are representing the first 3 criteria and how the community is connecting the dots between the accomplishments that they feature. Finally, following the essay, applicants are also required to submit a worksheet that summarizes each of their 4 accomplishments in a table format. This is a good summary sheet for reviewers to use as a quick reference for what is featured in the full essay. So now I will turn it over to Angela to talk more about the review process.
Okay. The goal of the Phase 1 review is to narrow the full pool of applications to those that demonstrate strengths in the first 3 criteria that warrant understanding more through the Phase 2 application. There is not a set number of how many applications advance. In the past few years, we have narrowed down the Phase 1 applicant pool to around 30 applications that move forward to Phase 2. In Phase 1, each application receives 3 reviews, one from a UWPHI staff member that works directly on the PRIZE program, one from a member of County Health Rankings and Roadmaps or Healthy Places by Design, and one from staff at RWJF. You will be assigned a set of applications that falls approximately within a certain population size range. This is to avoid reviewers having applications from opposite ends of the population spectrum, and to instead be looking across a set of applications that are somewhat similar in size. You will be completing and submitting your reviews via RWJF's online system, my.rwjf.org. You can read the applications online or download them to your computer or print them if desired. Please keep them confidential, however, no external sharing beyond the review team. Reviewers should rate the criteria and make the recommendations based only on the information provided in the application. To be fair to all applicants, please do not bring additional information from outside sources into the review process. Now, moving on to rating applications and making your recommendations. As mentioned, applicants are instructed to describe their community and 4 accomplishments in a way that helps reviewers see how they are living out the PRIZE criteria. And in the first phase, we hone in on the first 3 criteria. After reading the full application, you will rate each application on those first 3 criteria using this rating scale that ranges from limited evidence to exceptional performance. The table gives a sense of what each rating means, and you can use this to guide your criteria ratings. These ratings are for your own use and can serve as a reference point to inform your overall recommendation. This is also a space in the review form to make optional comments about each rating, again, for your own use. We will now go through each criteria in detail. You will be able to refer back to these slides and recording for clarity on the criteria. So the first criteria is defining health in broadest possible terms. On the next slide, you will find the full language of this criterion. Building a culture of health means using diverse and comprehensive strategies to address the many things that contribute to health, opportunity, and equity in our communities. To help applicants visualize this, we refer them to the County Health Rankings model. It's one way of thinking about the multiple areas that ultimately affect health. We know there are strong connections between social conditions, economic opportunities, and our health. We often get asked whether communities are required to have an accomplishment in each of the four health factors. There's not a specific requirement for one accomplishment per health factor. However, applicants are encouraged to elevate accomplishments that best exemplify the prize criteria, and as such are strongly encouraged to consider how work across their community reflects a balanced approach across multiple health factors. And again, they are instructed that reviewers will have particular interest in accomplishments targeting action to improve social and economic factors. When rating this criterion, please consider to what extent the community demonstrates actions that are across multiple areas that influence health, responding to local challenges and build on strengths, changing social and economic factors. As a reviewer, it is important to remember that while we all value work in health, behaviors, and clinical care, what sets strong prize applications apart is that they are going deep on social and economic factors and on sustainable physical environment improvements. So an application that does not address these factors in a substantial way is not likely to advance to phase 2. I'll pass it to Erin to go over the next criterion.
Our second criterion is committing to sustainable systems changes and policy-oriented long-term solutions. For us, this means making thoughtful, data-informed decisions that include a strategic mix of policy, programmatic, and systems changes that are designed to last. Changes that don't go away if a grant or a program ends. For an applicant to be competitive and move forward in the prize application process, they should be showing in their phase 1 application that they are going beyond providing programs and services to residents. A competitive applicant is making lasting changes to policies, systems, and environments, sometimes at the level of government, but also at the organizational level, for example, within businesses, workplaces, and schools. Applicants are also encouraged to demonstrate how they are using a strategic approach to problem solving that recognizes the value of evidence and the promise of innovation, and how residents, leaders, and organizations are collectively identifying priorities, addressing causes of problems, and taking coordinated action to implement solutions that have staying power. When rating this criterion, please carefully consider whether the community has data-informed decisions that demonstrate sustainable policy, programmatic, and systems changes, a strategic approach to problem solving informed by data, evidence, and/or innovation, and then collaboration across residents, leaders, and sectors to identify priorities, address causes of problems, and coordinate action towards sustainable change. So now back to Angela for criterion 3.
The third criterion is about creating conditions that give everyone a fair and just opportunity to reach their best possible health. This means intentionally working to identify, reduce, and ultimately eliminate disparities in health, and doing so in collaboration with those who are most directly impacted by local challenges. For this criterion, we are interested in how communities are valuing diverse perspectives and actively fostering a sense of security, belonging, and trust among our residents. We also want to see how the community is addressing disparities by taking specific actions to remove obstacles to better health. In particular, we want to see how communities are going beyond targeting programs and services to residents in need. Applications that really stand out in this criterion will be able to provide specific examples of how power and leadership is being shared with those who have traditionally been absent from decision-making processes, and how they are authentically engaging full participation from people who are historically excluded from opportunities in problem solving. Some relevant examples for this criterion include communities acknowledging complicated histories, drawing strength from their diverse cultures, and mobilizing residents and youth to improve neighborhoods and address issues from education to community safety to employment and income. When writing this criterion, we ask reviewers if the application shows actions to identify, reduce, and ultimately eliminate barriers that limit opportunity in collaboration with those who are most directly impacted by local challenges. Efforts to value diverse perspectives and foster a sense of security, belonging, and trust among all residents. Examples of shared power and leadership with residents who have been historically excluded from opportunities in problem solving and decision-making processes.
So in the phase 1, the primary focus is on criteria 1 through 3. But reviewers are also asked to indicate if an application includes evidence of outstanding performance in the remaining 3 criteria. So now we will overview criteria 4 through 6. Criterion 4, maximizing the collective power of leaders, partners, and community members, is about how individuals and organizations across sectors and disciplines are all working together to provide everyone in the community with the opportunity for better health. For instance, how are communities building diverse and robust partnerships across traditional and non-traditional health partners, including business, government, residents, nonprofit organizations, schools, faith-based institutions, and more? How are communities fostering inclusive civic engagement and leadership capacity among all community members and inspiring people to take action to support change for better health? And how are they developing methods for buy-in, decision-making, coordinated action, continuous communication, and shared accountability? The 5th criterion is securing and making the most of available resources. This means adopting an enterprising spirit toward community improvement efforts. So what do we mean by an enterprising spirit? We are eager to hear how the community looks at existing and potential resources and how the community integrates and aligns funding and other resources for maximum impact. In my mind, we are not at all focused only on financial resources, but human resources and assets. Residents, the partner organizations, the community institutions, and their natural resources. I also want to stress here the importance of communities making equitable decisions about how to invest resources and cultivating a strong belief that everyone can be a force to improve the community. The 6th criterion is measuring and sharing progress and results. It's about knowing where communities are headed and making a community-wide commitment to measuring the quality and impact of coordinated efforts. This involves several elements, including establishing shared goals and definitions of success across sectors and partners, identifying measurable indicators of progress, including tracking disparities in health, and continuously using data to improve processes, track outcomes, and change course when necessary. We want to see how communities are developing systems for collecting and sharing information in ways that go beyond measuring the outcomes of a single program and moving toward being able to determine impacts across their coordinated efforts. We also encourage communities to share how they are communicating and celebrating successes when goals are achieved. Now, as you review applications and assign criteria ratings, consider the application in its entirety and strive to review applications according to the criteria, not against one another. As you form your recommendations, stay close to the criteria and know that it is a high bar for a community to have exceptional or strong performance. Keep in mind that most applications will not make the cut. While many communities are doing admirable and noteworthy work, few will be doing work that is multifaceted enough and mature enough to rise to prize winner status. Your set of applications may or may not contain one or more applications that is strong enough to move forward. To aid in your decision making, we have created this summary, It is based on the range of work we've seen over the years in prize applications. It shows common characteristics that contribute to a strong prize application, as well as common reasons that applications do not move forward. Another resource is our diverse approaches to equity. Another thing we have increasingly focused on over the years is how communities are advancing equity and what that looks like. There are diverse approaches to advancing equity, and that is not an exhaustive or exclusive list, but strong applications tend to highlight work in at least some of these areas. You'll see that these approaches relate to elements across the 6 prize criteria. We have detailed this in a handout, which we will chat out now. The handout includes additional examples that are from prize winners that represent each of these categories. And we know the phase 2 application is a very heavy lift for communities, and they must deliver their application in a short turnaround time. So it is our charge as reviewers to only advance those that are truly ready to take this next step in the process. As you rate the criteria and formulate your recommendation, we encourage you to consider how well the application demonstrates the characteristics of stronger applications that were just discussed, and reflect on these questions. Does the available information indicate the community could submit a strong phase 2 application? And is there enough information about the first 3 criteria to warrant understanding more about the next 3? So to recap the process, first you will rate each of the first 3 prize criteria. Then you will answer a question asking whether the application includes evidence about outstanding performance and criteria 4 through 6 that makes it compelling to move forward. If you believe the application is particularly strong in one of the last 3 criteria, you will be asked to indicate which ones. So to reiterate, the rating is for your personal use to help guide your overall recommendation. At the end of the review form, you will provide a summary recommendation about whether the application should move forward with a yes, no, or undecided. You are also required to write a brief justification explaining why you chose that recommendation. If you mark that application that application showed evidence of outstanding performance in criteria 4, 5, or 6, please explain that in your justification. Your justification can be up to 1,000 characters, which is approximately 150 words, but it doesn't have to be that long. Try to keep it brief, but as clear and specific as possible. And finally, if your recommendation is undecided, within your justification, please include any remaining questions you have about that application and what information you need during the phase 1 review meeting that could help you make a final yes or no recommendation. If the application does wind up on the agenda for discussion and needs a final vote, then you will have the opportunity to discuss it and change your vote. Please note, checking undecided does not necessarily mean that the application will be discussed. Now I'll turn it over to Angela to share some reviewer tips.
Well, let's pause for a moment and use the chat. I think Olivia will post this chat question for me. What review tips and tricks do you have for reviewing if you are one of our veterans or at least have reviewed more than a year? So as you respond, we wanted to provide you with a few tips based on our past experiences of the review process. In our 2020 cycle, we actually had a technology glitch in my RWJF portal where some reviewers' comments were not automatically saving. Be sure to save your work frequently in the portal. It also may be helpful for you to type your comments into a Word document first and then copy and paste the comments into the My RWJF system to avoid losing your work. Refer to the next to last slide in this PowerPoint for key contacts, and contact us if there is something that we need to be aware of or if there is a similar glitch occurring as you review. For the review meeting on November 11th, we will be relying on your overall recommendation and summary comments to guide decision making. So this is why it is particularly important that you provide enough detail in your summary comments that they can stand on their own and that they are clear and understandable to others. Remember that communities are not competing against one another. However, you are rating the applications against the prize criteria. Keep the prize criteria at the forefront of your comments and include the specific examples from the application to explain and support your recommendation. Remember to unpack your thoughts. Explaining and unpacking your thoughts is helpful for understanding the different perspectives we bring. It is easy to fall into using shorthand and jargon when writing comments, but our reviewers come from different backgrounds and disciplines, and your comments will help inform the whole group. Please strive to specifically say what you mean and how it relates to the criteria. Our team often bumps into phrases like the community was not far along in the journey, or they were too early, nascent, not prizeworthy. These are types of comments to avoid and instead provide more detail about how they relate to your assessment of the prize criteria. The next few slides provide examples of how to apply these tips. And be sure to scroll through the tips that other reviewers are sharing as well. To give you a sense of length and level of detail, here is an example of a no recommendation. I will not spend time reading through each and every example, but this is so you can refer back to the slides if you have questions. Please note that for this example, we have highlighted where the comment refers directly to the prize criteria, particularly number 1, broad definition of health, and number 2, sustainable policy and systems changes. This is a sample yes comment. Again, we highlighted the types of detail related directly to the prize criteria that are extremely helpful for the review meeting discussions. You may have 1 or 2 applications where even after unpacking, you remain stuck and choose to mark the recommendation as undecided. Selecting undecided means you need more discussion during the review meeting to finalize your recommendation if the application has mixed reviews from the 3 reviewers. Here is an example of how to call out key questions and uncertainties that you have in the application where you would like to hear from the other reviewers assigned to the application in question so that you can make your final recommendation. Just to note, take time after you review your applications to see if you have more than 2 applications with undecided recommendations. Go through those applications and see if there are areas within your rationale where you need to unpack. That may help you move to a firm yes or no recommendation. Here is an example of how to unpack that language. Instead of using phrases like early in implementation, early in their journey, or not prizeworthy, you can add clarifying statements that point toward the prize criteria. Let's look at the time here. It looks like we have a little bit of time to actually open up and talk and chat about this a little bit. So thinking about our reviewer tips, how would you approach unpacking statements like early in their journey or implementation or not prizeworthy? What does that mean to you? You can unmute your lines or you can post in the chat and we'll talk about this for about 5 or so minutes. And because I can't see the chat, Olivia, if you can rat off any good responses, if there are any.
None yet to this question, although there's lots of great ideas in terms of reviewer tips, including giving yourself enough time, being able to look through your applications initially and then kind of go back and look at them more carefully.
Mm-hmm.
And Sarah would like you to repeat the question.
Okay, so the question is, when you are thinking about how to approach unpacking statements that need a little bit more clarity, like the community was not prizeworthy, how do you approach that unpacking? What does that unpacking mean to you? And in my own personal experience, I would also consider what elements of the criteria does this comment speak to, or what does it look like to be too early in implementation, and draw from examples of the application to do that unpacking to really say what we mean.
So a few things coming in here on the chat, which is building on what you're saying, Angela, is instead of making a blanket statement, unpack each criterion, especially 1 through 3 that we're focusing on right now, at a time relevant to the issue you're addressing. So if it's something that seems not ready yet, maybe it's that it hasn't shown sustainable change according to criterion number 2 or something like that. Rather than saying, Joanne says, rather than saying prizeworthy, just cite the specific criteria that are not met.
Yeah, that's a good one.
And Carrie's noting too that accomplishments do need to be in the implementation phase. So if it's just sort of still an idea that hasn't been implemented yet, we wouldn't maybe consider that as a full accomplishment. Justin, you jumping in?
Yeah, I was going to say, I think to Carrie's point, I think the kind of maturity of the work for me is always important, because I think that communities will lift up that they rallied together and developed a multi-sector coalition, 6 months ago, but they haven't really moved to any substantial work yet or implementation. So really thinking about how far along the work is important.
That's a good one.
And that looks
Justin.
different for every size of community, but.
Yeah, the journey is always different. There's multiple pathways, but I like that point of looking and seeing exactly where they are in their planning and their implementation and drawing out those examples. That's great.
When I see those kinds of examples, I tend to go through the application and then try to highlight, okay, what action came out of this plan? What action came out of this coalition? And then if I can identify the actions from what they've written, it helps me evaluate it better.
Yeah, just thinking back, because last year was my first year reviewing, so I was going through and using those optional comment boxes for each criterion and actually pulling out examples. So then that way it would be more helpful for me in that last recommendation box to really pull those in there and be more specific. So awesome. Well, thank you all for that chat. If there's anything else, be sure to use that chat function. We love the chat function on our Zoom. And also to note, when you start unpacking your recommendations and moving yourself from that kind of unstuck place, it could, again, move you to a definitive yes or no. With this particular example, it moved that undecided piece to a definitive no. So while reviewing, you may pick up also on some tensions in regard to the interpretation of the criteria, accomplishments that are considered at the forefront, and whether or not that idea of forefront differs based on community size and type. Regardless of size or region, in order to appreciate a community's multiple pathways to building a culture of health, it is important to keep in mind the context and history of that community. How is the community acknowledging its history and working towards addressing community-specific challenges? Every community's journey to building a culture of health, again, is different. In fact, the prize criteria serves as our lens for evaluation, but are not checklists. For example, elements of advancing equity show up across the criteria, across all 6 criteria. Given time and space limitations inherent in the applications, a successful application does not need to include all approaches in order to demonstrate their commitment to and the action on equity. Reviewers often question how much to weigh and assess work across health factors without deep work in social economic factors, or those that focus on one particular neighborhood or organization. That's probably one big one that we have sometimes. As a reminder, we aim to select whole communities that are at the forefront. And this brings in what you've probably noticed earlier in the chat, forefront can vary in meaning for us based on our lens and where we're coming from and our perspective. Past reviewers have shared that communities at the forefront are working toward changing conditions that are implementing policy system and environment changes. Competitive applications are not just doing impressive things in only one area or one issue, but they have a through line, a comprehensiveness and connectiveness in their accomplishments across criteria and across the whole community with breadth and depth. Just a note, in the screening process, we screen out applications that very clearly do not meet the eligibility requirements, but you may see some applications that may be narrow in scope for reviewers to decide if the community moves forward. Remember, the prize honors whole U.S. communities. Strong applicants demonstrate accomplishments across sectors and partners in the community and beyond one neighborhood or population group. Consider what lens you bring to reviewing and think about how that may affect your review process. Finding balance and comfort in these tensions may be difficult, but that's why we have the review meeting. And in that review meeting, we can call out and discuss some of those tensions and existing questions and work towards consensus. Well, I'll turn it over now to Erin to close us out with the remaining slides.
Thanks, Angela. So now a few notes about the November 11th review meeting. We will email the materials, including the results of the reviews prior to the meeting. Your recommendation and your final summary comments will be made available for all reviewers to read. We will spend the bulk of our time during the meeting on applications with mixed reviews. Then there will be time, or with that, there will be time for the 3 reviewers of the applications with mixed reviews to discuss it. The 3 reviewers will strive for a consensus recommendation. A vote will be called with a yes or no option only. So this will result in the final recommendation for the application. If you are for some reason unable to attend the meeting, and if any of your applications fall in the mixed review tier, we will need you to identify a proxy in advance who will have to be familiar with your application and the assessment and be prepared to vote for you. And more information about all of that will be forthcoming. So as a reminder, reviews must be submitted by Thursday, November 5th by 5 p.m. your local time. We do have a very tight turnaround and we appreciate your timely reviews. And then the phase 1 review meeting will be held on November 11th from 9 a.m. to 12 p.m. Eastern time or 8 to 11 a.m. Central time. So now we're going to open it up to questions. You can either unmute your line or put your question into chat.
Joanne asked for clarification on whether the 4 accomplishments need to address different social economic factors. So I wrote something in chat and asked my colleagues if it seems like a response that makes sense, but we're not looking for any checklist of like they covered this and this and this factor, but we are saying we want to know what are the community's challenges. Are they doing work across more than one factor that influence health? Do they have a focus on social and economic factors that will really get at the root cause of some of their community challenges? And do they have sort of a balanced approach across their work?
Yeah, I think that's a great response. I think it's the balance, it's that breadth and depth, and just looking across. I think you hit it on the nail to me, Olivia. Dr. O, as we like to call her.
So let me know if that helps, Joanne. And we're getting questions. I'm gonna let you guys answer this. Any sense of approximately how many applications we might expect to review? Oh, like per person?
Per person.
Oh, okay.
So
Okay, yes,
we're still working on that projection. But maybe 7 per person, maybe. That's my hunch, but it could be more, it could be fewer. We just don't know just yet, but we'll let you know when we know. But
I might just say,
go ahead, Carrie.
I just want to say it might.
Oh, go ahead, Carrie. Go.
it might vary based on what team you're on too, how many you'll have. So some folks will have a little bit more than others, depending on what team, what the team makeup is. So in other words, the CHR, County Health Records Roadmap staff might have a few more than RWJF staff. So it varies, and we will know as soon as applications come in for sure.
Mm-hmm. And this year it's just a little bit different because of COVID-19, and so we are seeing a smaller pool so far that have registered and are actually, you know, submitting their applications, and so that will affect how many applications we indeed review.
Angela, Justin says you have a very politician-worthy response to how many.
Well, you know,
Responded on the
I'm
question
not
pretty
going
well.
time soon into politics ever. So, but thanks, Justin. I appreciate it. Any other questions? We have a few more minutes till we're on the top of the hour.
And we're not a big group, so feel free to just unmute and jump in too.
Yeah.
Thank you, Carrie.
Yeah, appreciate it, Carrie. Carrie's going to record our panel for next week. We're having the community conversations for our prize-winning communities, and so it's going to be a cool virtual convening for them. We'll see how she does, how she facilitates that panel. So she has a very powerhouse group too to wrangle. So well, I'll pause just for a minute and see if there's any burning questions. If not, we'll pass it over to Erin and close us out.
Yeah, great. Thanks, Angela. And another note, what's interesting is the event next week switched to virtual, but this review meeting was normally done virtually. So that's one change we didn't have to make this year. So you all be used to that same format if you were involved last year. Okay, no other questions? Okay, well, to close out, we just want to encourage you, use the call for applications, and there's also an associated frequently asked questions packet to look through those. That may help. If you have any other questions about the review process, reach out to Angela with UWPHI. And then if you need technical assistance using the myrwjf.org system, you can contact Helen Matthew at RWJF. And then finally, we'd like to close by acknowledging the collaboration between UWPHI and RWJF on the prize. It is a full team effort, we know, and thank you all for your contribution as a 2021 RWJF Culture of Health Prize Reviewer. Thanks, everyone.
Thank you.
Thanks. Great to see everyone.